Hello, good
Yeah.
morning.
Good morning, ma'am.
Yeah. So are you ready for the first card? Can you read the card?
Okay. The settings is hospital. You are talking to a 56 years old patient, a heavy smoker who has just been admitted with bronchitis. Find out about the patient's general background, family, home, habits, and general health. Also, respond to the patient questions about giving up smoking. Give advice in a positive and friendly way.
Okay. Now the time is 9:31. You make note the time 9:31. Did you prepare for the card?
Yes, ma'am.
Already you are prepared. I told you no, today onwards it is mock. Okay, fine. If you are prepared means 8 minutes only we are speaking. Okay. 2 minutes we are reducing because preparation time is 3 minutes. Okay.
Okay.
So within 8 minutes you have to speak. So now, wait, let it be. What is the time in your watch? What is the time it shows?
9:31.
9:31. Okay, start.
Okay, good morning. My name is Anupola, one of the registered nurses who is working in this department. Today I'm going to take care of you. How do you feel now? Did you sleep well last night? Do you have any chest pain or discomfort? Are you okay?
Well, now it's good to know that you are going to take care of me. And what's your name? Are you Anu?
Oh, my name is Anupol.
Oh, good to know that. Yes, of course, I'm suffering from this bronchitis, and because of this, I have a severe breathing problem. I'm unable to breathe properly, and I know that it is mainly because of my chain smoking. And but
Mm-hmm.
I never thought that because of the reason I could be admitted in hospital and it could lead to certain complications like bronchitis. Fine, I just want to know what is the treatment for this and how early I could get all right. Is it curable? Could you please know or explain to me all those things?
Yes, sure. I will explain to detail one by one. I know you are recently diagnosed with bronchitis. It's a curable disease. In your case, you are diagnosed acute bronchitis. It means infection and inflammation of the bronchi and lead to some infection and inflammation of testicle. But we can manage the help of medication about treatment. So it is a curable condition. So no more worry about this condition. Okay. There are lots of causes of bronchitis and uh, cold, some other dust and smoking. In your case, the main reason is smoking. So, try to quit smoking. Otherwise, complication problems. So, we can
Well,
manage the.
you are saying it very easily to quit smoking because you must understand I have turned into a chain smoker. I'm addicted to smoking almost 30 years. So I don't
Mhm.
think it is that easy for me to quit. Yes, of course, being a mother of three teenage children, I tried many times during my pregnancy in order to quit smoking, but hardly I had controlled my smoking habit. That's my situation. Though I tried many times, I failed in it. I was unable to quit smoking. But very easily, you are saying that I have to quit smoking. I find it really difficult. Even I just attended this rehabilitation center in order to overcome this. Then also, I find it difficult. So let me know the seriousness of this bronchitis. What am I supposed to do? How to overcome this smoking habit? I know overnight I don't think it is possible for me to quit it. So in case if I don't quit, what are the no further consequences, medical complications do I need to face? I need to know now.
So I'm really happy to hear that you are trying once you are trying to quit smoking. I'm sure that you can definitely you can quit smoking. I'm seeing so many patients with same condition. Now they are living good life with the help of some other management. For that we have some effective strategies and management to cope up the uh, quit smoking. Before that, uh, sorry. I'm already sorry. It's a bronchitis. It's not a serious condition. If you have not tried to quit smoking, it will cause some other complications. It will hardly affect your lungs and other. lungs, liver, another whatever lungs and liver, other organs. Today, if you try to quit smoking, you can good health and more energy. You will get good taste and sense of smell. Before that, if you don't mind, I need certain clarification regarding your family and background. Shall I?
I already informed you. I live with my husband as well as I have three teenage children. During pregnancy, I tried to quit smoking. What else do you need to know about my family? I already informed you. I think you didn't hear what I said.
Okay, don't worry. Okay. Well, for kids smoking, we have some effective strategies. I will explain the detail one by one. The first one is called turkey method. It is the reduce the cigarettes one by day. And first you set one day in your mind and gradually set the 2 cigarettes per day. Finally, that day will come. And another method is when you urge to smoke, you can use nicotine patches and nicotine gum. It will get
Well, I like to say, as per your knowledge, that you are advising me to go for one by one or two per day. Already, I started. See, earlier I had the habit of smoking almost minimum 3 packets of cigarettes, and nowadays I'm just smoking hardly 4 or 5 cigarettes only. So I want to know that how to quit even this. Because just now you are saying me to stop one by one. I was smoking 3 packets. And now I had reduced it almost to hardly 5 or 6 cigars per day, which means every 2 hours, one or not even every 3 hours or 4 hours only I'm smoking. Maybe because of my age, I think this bronchitis I'm facing. But yes, of course, I want to know what to do in order to stop it. I want to quit, but I'm not able to quit. So that's the reason I'm asking you any other idea that you could suggest me how to quit.
so I can really understand your feelings, madam. Okay, you are only told to inform to me you are 36 years old and you have 2 children. To think about your children's future. So if you smoke today, tomorrow your children imitate you. You know parents are the role model of children. And moreover, one thing, if you smoke, who all are around you, they will affect it more than you. That means
Of
fast is
course,
smoke.
I know all these things, and it's really irritating to get more advice. I don't want any more advices. Better you can suggest me if there is any way to quit it.
As I know, you are just 36 years old and looking very so cute and young. And if today if you quit smoking,
I
tomorrow.
told I am 56 years old.
Okay. Okay, you are only informed to me you are just 56 years old. But you are so, you are looking so cute and young. Today you quit smoking. Tomorrow you didn't get any health problems like heart disease or lung problems. No, you didn't get any other problems. Health is very important factor. If you because of your health is my priority. That's the reason I inform you to try to quit smoking. I know it's very difficult situation for you. Once you try to quit smoking, you will get a good life, and you have 2 children. Think about your children fast. Because
I don't like advice I told, and no, you are not understanding. I don't want your advice. You go to the point. What should I do in order to quit smoking?
moreover, okay, here we are conducting smoking cessation program. Once you join the program, you will get more idea how they quit smoking and now how they would lead good life. If you are interested, I will join with you that group. Are you interested for that?
That's the thing I want to know. What should I do in order to quit smoking?
So, madam, think about your health and now you diagnosed bronchitis. In your case, your doctor diagnosed and they started treatment earlier. So you are in safe because of this is acute bronchitis. It will cure within few days or few weeks with the help of medication. If you are continuous smoking, it will lead to some other complications. It will hardly affect our heart.
Not, I think you are not understanding. You are wasting my time. You are again advising, and you are talking only unwanted things. I asked you what should I do in order to quit smoking. You just say the rules and regulations. What all the food I have to or something. If I get the urge, what should I do? You have to concentrate in that. You are not advising. I don't want advice, and I don't want stories. I very clearly I asked you what should I do to quit smoking. Already I have reduced my intake. Now I want to quit once for all. What should I do?
If you reduce smoking, you can use nicotine gums and patches, and moreover, you can play with your children. They will after that they will help. They will happy, and you also more happy. And if you feel some
Well, playing with my children, I don't think it is possible. I already told they're all teenagers. They have their own, work and other things. They are not in an age to come and play with a 56-year-old mother.
okay, fine. So a little smoking, you can take instead of smoke, you can take more fruits and vegetables. With the help of you can replenish your energy, and you feel enhanced with good health also. Once you try to use salad or other things like fruits, like cucumber or others, you will get more replenish your energy also. And if you are smoking, you can participate indoor and outdoor activities like yoga, meditation, and other play like tennis or other things. And with the help of yoga and meditation, you will get more energy, and you will get a pleasant situation.
Well, let me try it because I'm a working person. I run my own business, and I need to run behind things. And hardly I find time to whatever you say to attend yoga class or meditation. Fine. Anyhow, it is a high time. I need to think on it because I have growing teenage daughters. I have the responsibility until they stand on their foot. I should be a great support financially, physically, and morally. As a mother, I realized that this is a high time for me to look after myself. Anyhow, thanks for the suggestions and advices given by you. But my final question to you is, it is a hearsay. Some of my friends, they told me that bronchitis at times could turn into pneumonia. Is it true?
Yes, you are right. Your friends' information are right. Once they are not treated now, it will it will lead to pneumonia and other problems. In your situation, you are safe because of you have started earlier treatment. So no need to worry about it.
So what is the bronchitis treatment? What treatment will be given to me?
It's a good question from you. In your case, your doctor only prescribed antibiotics and some nebulization and bronchodilators because of you have some cough and some difficulty, breathing problems. For that, your doctor has prescribed the medication for this medication.
Well, I just want to know how early I could get rid of this bronchitis. I want to, get cured faster. So, is it possible?
This is 1 4 months.
I just want to get rid of this bronchitis as early as possible.
Oh, it's a nice question from you. Once you treat bronchitis, no way to chance reoccur this condition because of you are trying to your case the main factor is smoking. Once you quit smoking, no way to chance the reoccur this condition. because of the another factor is cold and other dust will lead to main factor of bronchitis.
Well, nurse, to some extent, you have clarified my doubt. I think I could directly speak to the doctor to get some better information. Thank you.
Welcome. I hope I experienced all doubts regarding your condition. If you have
To
any
some
doubts,
extent, I am not clarified with all my doubts. Only to some extent my doubts were cleared. I feel it is better if I speak to the doctor. Thank you.
welcome.
Yeah. Okay, fine. Do you understand what mistake you made?
Yes, ma'am.
Yeah, when I was saying, see, I already told, card is just for your information. You have to read the mind of the patient. You have to develop your dialogue based on the way the patient is speaking. If the patient is cooperative, friendly, you have to be friendly, it is given. But you should not expect the patient to be friendly because I am already 56 years old woman and working woman, and I'm a smoker, chain smoker. So people who are into drinking and smoking and all, they never speak to you very politely or in a humble manner. They might be rude and they might be arrogant because of that, narcosis in their brain. The toxin is very high, and also the bronchitis is something very severe. It is dangerous. When you speak, you have to say that. Whenever I'm asking, in the initially itself, when I started itself, I told you that I'm a chain smoker. I know that it is very difficult for me to quit as a habit, but I never thought I could land into bronchitis and get admitted in the hospital for treatment. Now it is a high time I'm thinking about. Then you have to say that in that place, of course, now you have realized because of the chain smoking, smoking is the main reason for your bronchitis. Bronchitis is nothing but it is a kind of blockage in the lungs because of the smoking habit, and so you have to take care of it. And this is the right time. At least now you have to try to quit smoking, and you have to get the proper treatment. In case if it is untreated, it could lead to pneumonia. Then it is more like life or death situation. So definitely you have to undergo the treatment. So that idea in the beginning, when I was saying that, I never thought that bronchitis I will get. By the time itself, you should have spoken. Then when I was asking you, fine, what should I do in order to overcome this, smoking habit? Then you should have told, this way that. Have you ever, you should have asked me, have you ever tried to quit smoking? Or is this the first time you want to try? That question you should have asked. Then by the time I would have informed you that, yes, of course, during my pregnancy, because I am a mother of three teenage children now, I'm a working woman and I have a dependent husband. When I was pregnant, meanwhile, during my pregnancy, I tried to quit, but it was not possible. But to some extent, I controlled, and once again, I got into chain smoking. So this is how I'm leading my life. You should have asked that question. Did you ever try to quit smoking? Then only I would have told you that yes, I tried, but honestly speaking, earlier I was smoking more than 2 to 3 packets of cigarettes per day, but now I reduced it almost 5 or 6 cigarettes per day. So that itself is a big achievement from my side. For that, you should have told, good to know that. I really appreciate your effort. I can understand people who are into chain smoking, they really find it difficult, though they want to come out of it. For that, certain things you should have, planned and you should have executed. First and foremost, you should not buy and keep it. Already the cigarette topic we have spoken. So that idea is only you have to bring it to. Don't accumulate or don't store or keep packets of cigarettes at home. Always you make it a point whenever you want cigarette, you are going to shop buying and smoking. So that way you can postpone at least, so sometimes you might be busy. So you at least 1 hour, 2 hour, you will not smoke. So this all the way you have to follow. And you should avoid the company of people who are into smoking either in your workplace or in your neighborhood. Because if you see someone smokes, automatically you will get a urge to smoke. You will start giving company to that people. then it is very difficult. And apart from that, keep some candy or clove or cardamom always in your handbag or purse or in your pocket. Whenever you get the urge to smoke, immediately take a cardamom or a clove or any candy and munch it. So when you start to munch something, to some extent you could avoid the smoking urge. Nicotine patch and all you should not do, because nicotine also people are getting addicted to that. Advice you should never bring into. Are you hearing whatever I'm telling?
Yes, ma'am.
Yes. And apart from that, then you should have checked. I already told you that I have three children, teenage children. Then you are asking that before that I want to know how many members in your family. So which means you are not following what the patient is speaking. This is your problem. Every class I'm telling. Today also you repeated the same. So be very careful, and before you ask the patient, did you ever try to quit smoking? Before you advise, you have to ask, did you ever try to quit smoking or tried to reduce the number of cigarettes? Then the patient will speak. Hearing that, you have to. Don't keep advising. And when you start to advise, because I am 56-year-old. 56 is the people who are in the age group of 40 to maximum 60. They don't like anyone advise them, because already they are in middle age and they have their own decision making, stress level, and all these things. If someone advice, they never like them. And especially people who are sick, ill, and because of their bad habit like addiction. If you keep advice, it will irritate. So you started to advise. When I told you once, I don't want you to advise or anything. I just want to know what should I do. Again, you were advising. Do you understand what and all mistakes you made?
Yes.
Yes. You cannot expect the examiner who is speaking to you as a patient, to speak friendly. Because sometimes in the card it will be given the patient mood is, a mood thing is there. The patient is anxious, tensed, and irritated. Sometimes it will not be given. So when it is not given, then you have to be extra careful to understand each dialogue spoken by the patient. When the patient is speaking, you have to understand if the patient is friendly or angry or getting irritated. Accordingly, you have to change. Again, you are repeating the same way, the monotonous way of dialogue you are repeating. Anyhow, one thing I appreciate, you had spoken confidently. And whenever I was asking you what should I do in order to quit, you have to say these things. Avoid the company of people who are into smoking. Don't buy and keep cigarettes, packets of cigarettes or cigarettes at home. Always, whenever you want even one cigar or anything, also you make it a point you are going to shop and buy it. So that way, at least 1 or 2 hours, you could postpone your smoking habit. So that will help you to realize, because you are. And one more thing, as you are a mother, definitely, automatically your children might learn this bad habit. Then it is very difficult for you to control your children. So in front of children, don't ever smoke. So this kind of some kind of mind control you can do. Apart from that, you can do breathing, because lungs or bronchitis is nothing but it has weakened your lungs. So you have to sit and do a breathing exercise, which could help to expand the lungs, and inhale, exhale will really help to get some kind of fresh air. And if possible, some kind of yoga, meditation are there. And we are providing rehabilitation center. You can enroll, and you can take classes over here. So these are all the things we could arrange for if you are interested. That together, when you are speaking, you have to say, not after. First of all, you have to say ask, and then when the patient is speaking, then you have to ask, what is your next question? Immediately, you should start to ask, may I know about your habit and family members? What is your food habit? How many members? That is all. The second question itself you should have asked. You didn't ask. It is very clear what is the thing you have to ask. And bronchitis is very serious. If it is untreated, it will lead to pneumonia. That is very important point you have to speak. Because bronchitis is not something easy disease. It's very dangerous. Okay, it is very acute and dangerous. You know, right?
Yes.
Hmm. So I told in the last class itself, when you are getting B by the day, I tell your score B. If you don't get B less than that and all, I don't want to give C or C plus or anything. Right?
Fine, fine.
So I didn't give you B today, which means it is understood. Still more you have to work on for. Go to the second card. Read the card.
Okay. Children's hospital ward. Elizabeth, a 3-year-old girl, has come with her mother to be